How do tPA drugs dissolve brain blood clots? Have you ever wondered how certain medications can help dissolve blood clots in the brain? One of the most effective treatments for this is tissue plasminogen activator, commonly known as tPA. This drug plays a crucial role in treating ischemic strokes, which occur when a blood clot blocks blood flow to the brain. When a clot forms, it deprives brain tissue of vital oxygen and nutrients, leading to potential damage. tPA works by activating the body's natural clot-dissolving system. It specifically targets a protein in the blood called plasminogen. When tPA is administered, it converts plasminogen into its active form, called plasmin. This is where the magic happens. Plasmin is an enzyme that breaks down fibrin, a key component of blood clots. When tPA enters the bloodstream, it binds to fibrin within the clot. This is important because it allows tPA to focus its action on the clot itself, rather than affecting plasminogen that is freely circulating in the blood. Once tPA activates plasmin, the enzyme starts to cleave the fibrin strands, breaking down the structural framework of the clot in a process known as fibrinolysis. As the fibrin breaks apart, the clot begins to dissolve, reopening the blocked blood vessel. This restoration of blood flow is critical, as it can significantly reduce brain damage caused by the stroke. The action of tPA is mostly localized to the clot, which means that any plasmin that escapes into the general circulation is quickly inactivated by other enzymes. This minimizes the risk of unwanted breakdown of proteins elsewhere in the body. Timing is everything when it comes to administering tPA. It is most effective when given within a narrow time window, typically within 3 to 4.5 hours of the onset of stroke symptoms. This makes rapid hospital arrival and diagnosis essential for effective treatment. In summary, tPA drugs work by catalyzing the conversion of plasminogen to plasmin directly on the fibrin clot. This targeted action leads to the breakdown of the clot and the restoration of blood flow in acute ischemic stroke. Understanding this mechanism highlights why tPA is a cornerstone of acute stroke treatment, improving patient outcomes when used promptly and appropriately. Always consult healthcare professionals for personalized medical advice regarding stroke treatments.